Dementia symptoms can differ depending on which part of the brain has been affected and what type of dementia an individual has. While many people show signs of dementia as they get into their 70s and beyond, early-onset Alzheimer's disease can start in the 40s, 50s, and early 60s. Symptoms of early-onset Alzheimer's include the following: memory problems. This is often the first sign loved ones notice. Typically, someone with early-onset Alzheimer's will forget recently learned information or events. Other signs include forgetting important dates and asking the same questions over and over. Personality changes. Subtle behavioral changes may start to occur, along with mood changes. Patients with early-onset Alzheimer's tend to lose their confidence easily and may become irritable more often. They may become less interested in activities they previously enjoyed. Confusion. Those with early onset have a hard time dealing with unfamiliar situations and quickly become confused. They may also lose a sense of time or even get lost in familiar areas that they should easily recognize. Sometimes they may forget where they are or how they got there. The patient may put things in unusual places, like leaving car keys in the refrigerator. They may also lose things and then accuse others of stealing them. Difficulty with words and communication. Aphasia is a condition that often occurs among early-onset patients. According to the Mayo Clinic, aphasia robs you of the ability to communicate. It can affect your ability to speak, write, and understand language, both verbal and written. Forgetting names of familiar people, places, or things becomes more common, and they may use incorrect names for easily recognizable objects. They may stop in the middle of a conversation, or they may repeat themselves often. Trouble planning, organization, or problem solving. Concentrating becomes a challenge. Some people lose the ability to develop and follow a plan, work with numbers, or complete familiar tasks. They'll leave tasks half done and forget they started them. Easy tasks take much longer to do than they did before. They may not remember the steps of a favorite recipe. Judgment or decision-making becomes more difficult, especially when it comes to money. They may forget to keep up with monthly bills. They may also become lax about grooming or keeping their environment clean. Trouble with vision and judging spatial relationships. Vision problems often occur with early-onset Alzheimer's patients, leading to trouble reading or difficulty with balance. They may also have problems judging distance and determining color or contrast, which makes driving a vehicle dangerous. They also have problems judging speed or distance. Alzheimer's is a progressive disease, which means symptoms get worse over time, so spotting them as early as possible is especially important. Treatment and early diagnosis can slow the progression of the disease and help the patient maintain mental function as long as possible.